Hello everybody, my name is Dr. Josh Caldwell. If we haven't already met on your first day, then you will be meeting with me at your next appointment to go over your x-rays with you. Before we do that though, I wanted to go through a quick x-ray review so you guys have some idea of what it is that we're looking at, what it is we're concerned about, so you have some general knowledge before we sit you in front of your x-rays. Unless you're a radiologist, you're really not going to know what you're looking at, so it's important that you take the time. I know it takes a little time out of your day, but please watch this video to its entirety. That way you have a really good understanding of what it is we're trying to explain to you. So the x-ray review, we're going to go over different aspects of your x-rays. I'm going to try to do this as quickly as I can, but if you remember from the first visit, we talked about the alignment of your spine and how important that is. Now, if you remember, from the back or from the front, your spine should be straight. From the side, you should have this S-shaped curve. No matter what reference you Google when it comes to the skeletal structure, this is how it should be. The purpose for the curves from the side and not from the front or back is that it acts like a coil or a spring to absorb shock of gravity of your own body weight, because that will dissipate the weight throughout your spine, as well as your muscular attachments and the spinal cord, where the spinal cord has to travel through and the nerves have to exit from. It's the most healthy, biomechanically proper position for the spine to be in. So if you remember also, we talked about in your first visit what a subluxation is. Now a subluxation is when any of the 24, because you have 24 different movable vertebrae, when one of the 24 vertebrae has shifted out of alignment or out of position. The concern with this we'll discuss in a second, but that's technically what a subluxation is. Because your spine has three jobs. It's got to hold you up vertically, it's got to be able to move you around and twist you and bend you. That's why there's 24 separate segments. But most important thing it's got to do is protect the spinal cord, which travels right through the center of it. Now, it's very simple and easy for your spine to shift out of position without you knowing it, which we'll talk about in a second. Now think of the alignment of your spine kind of like the alignment of your car. Even if your car is brand new, and it's a little bit out of alignment, the tires are going to wear, the steering wheel is going to shake, and the car's not going to perform as well as it should. So alignment of your spine is as critical, if not more, obviously because it's your body, than the alignment of your car, because you could change the alignment of your car at any point you want, but if your spine gets too unhealthy or too out of position or subluxated, it's going to be very difficult to do it the longer it's been that way. So the three concerns we have when your spine is subluxated or out of alignment is degeneration of the bones and joints, herniation of the discs in between the vertebrae, which are kind of the shock absorbers, and then compression of the nerves and spinal cord. The spinal nerves that come out of the spinal cord, there's 31 pairs of those. If your spine is pushing into one of those nerves, it's going to have very severe consequences. So those are our primary concerns with the subluxation. We're going to elaborate in a minute. Now, how would you know if your spine was healthy? This is an important question, because there's a few medical studies and osteopathic studies and chiropractic studies that they've done in the last 20, 30 years that are really eye-opening. So the first study determined that 75% of everybody walking the earth with or without, the key word or without, pain, already has at least one bulging, if not herniated disc in their spine right now. And if you know much about a herniated disc, think of the disc like a jelly donut. The outside is firm, the inside is jelly. If I squeeze one side of the jelly donut, which when you're subluxated, you have two different surfaces of the spine pushing on the disc at different ends of the disc, it's going to push that fluid outward, which will bulge that jelly out of the donut. And then eventually, if that gets strong enough, now you're looking at more of a surgical condition. So 75% of everybody walking the earth has at least one bulging, if not herniated disc, according to the medical studies. This was a really eye-opening study too. 37% of people in their 20s are in at least phase 1 of spinal degeneration if they don't have pain. If they do have pain, they're in more of a phase 2 or greater. There's only 4 phases of spinal degeneration, and that's people in their 20s. This study was done in December 2015 by the American Journal of Neuroradiology. So they took, I believe, 3,000 people from 20 to 50 years old and took MRIs of their spine to find out how many of them had bulging or herniated discs. So pretty critical information. Also a good thing to know that within weeks of a subluxation, nerve death, spinal degeneration already begin just within weeks. That was done by in November 1999 by the Journal of Bone and Joint. But that's already starting within weeks. So people want to wait till something hurts, which you wouldn't do that with your tooth. If your tooth was hurting, you'd be the dentist that day. Your spine we tend to put off until it's severe enough to see somebody. Another key thing to remember is that 90% of subluxations are painless. The reason for this is if you look at the anatomy of a spinal nerve or the spinal cord, a very, very small percentage of that actually feels pain. So you can squeeze a large part or pinch a large part of a nerve and not have any pain at all. You may get numbness, you may get tingling, you may not feel any different, but it can still be compressed. So it's important to understand that just because your spine doesn't hurt or hasn't hurt every day doesn't mean it's healthy. You know, you wouldn't brush your teeth only when they hurt because you wouldn't have many teeth left. So you do it on a regular basis. But when it comes to your spine, don't analyze the health of it based on how good or bad it feels, because on vice versa, you could be in a lot of pain but still have a pretty healthy spine. So, you know, the test will reveal, which is why we're going over this, because we're going to go over your actual test results the next time we see you. That's going to determine whether you're healthy or not. You wouldn't base somebody's, you know, blood pressure or the likelihood that they had diabetes on how they felt, because that's not an adequate way to measure that. So next thing, how would you know if you in general were healthy, kind of like the spine? You know, this gentleman's obviously having what looks like a lot of chest pain. More than likely he's suffering from a heart attack. Now, if he felt good yesterday and he's having a heart attack today, obviously he wasn't healthy yesterday even though he felt well. So that's kind of the concept we try to get across. I'm going to zip through these. We'll save this for a different time. That's more to do with kind of the medical routes you can use in terms of pharmaceuticals to help you, you know, relieve your discomfort. Time for another, our topic for another time. But, you know, even when it came down to heart disease or cancer, the only way you're going to know this is if we run some sort of test. So probably the most important thing to get from this is that 40 to 70% of your cells are diseased or damaged before you ever feel pain. And this was from the Journal of Medical Pathology. So whether it's, you know, spinal pain, whether it's, you know, liver issues, any part of your body has to get 40 to 70% damage before you're going to feel it. And it's going to take a long time before it gets even 40% damaged, let alone 70. So we're talking years, if not decades, of accumulated stress and trauma to your spine or any part of your body before a symptom's ever going to show up. So what is health? A lot of people want to be healthy. They don't really know how to define health. If you ask somebody what does health mean, they'll typically tell you, well, you got to eat good, you got to exercise, you got to manage your stress, but those are things you do to get healthy. That doesn't necessarily describe what health is. So according to the World Health Organization, health is optimal function of your body mentally and physically, not merely the absence of sickness or disease. So essentially, health is how functional your body is. Now, everyone walking the earth, whether you're in first grade or 12th grade, knows that the brain is in charge of every function in your body. So we all can understand that. That's not theoretical, it's factual. In order for your brain to control all of the different organs, glands, and muscles of your body, it's got to send a signal through your spinal cord, out of your spinal cord through what we call a spinal nerve. Like I mentioned before, you have 31 spinal nerves coming off each side of the spinal cord. Those spinal nerves branch into hundreds of thousands of different nerves in your body. But for this description, every signal from the brain's got to go through the spinal cord, out a spinal nerve, to an organ, to a muscle, to a gland. So for example, in order for the brain to control the heart, a signal has to be sent from the brain, through the spinal cord, through a nerve, to the heart. Now if you're subluxated and your spine is out of alignment right here at C7 or what we call T1, it's going to put pressure on the nerve or even the spinal cord going to and controlling that organ. So you can imagine if the brain controls the heart through the spinal cord and through the nerve coming out of here, and that nerve is getting compressed, not only could you feel some neck discomfort and reduced range of motion and maybe even some swelling, but it's going to interfere with the communication from your brain to your heart. Not a big deal 1 day or 2 days, but year after year after year of the heart not getting the right electrical signals to and from the brain. It's just like a plant not getting enough water. That plant is going to get sicker and sicker and sicker. Same will the heart. Now this is not chiropractic, although it sounds like it. This is basic human physiology. If the electricity to the heart is inadequate, something is going to misfire, something is going to be dysfunctional, and dysfunction eventually can lead to disease. So we don't want to just get something to feel better. We want to make sure internally every part of your body is functioning correctly, because at the end of the day, that's what's going to get you to feel good, that's what's going to get you to live longer, that's what's going to keep you functional doing the stuff that you like to do. We don't want you to feel good but not be able to do anything and not be able to move. That's not really very productive. So let's go over what good and bad x-rays look like. So this is a side view x-ray. So we're looking at the side of a neck. We took this x-ray of you, and this person would be facing this way. So we're going to show you this x-ray of yourself once you come back in. So I want you to notice a few things. Again, this person is looking this way. We're looking at the neck from the side. Notice this kind of banana-shaped curve we have in the neck. That is really, really important. That curvature, like I mentioned earlier, absorbs the weight and shock of your head, because your head weighs roughly 12 pounds. And when you add gravity, which could be 16 to 17 pounds on top of the 12, squeezing down on your head, if you don't have that curve to absorb the shock, it's kind of like not being able to bend your knee. And if you had to walk and run with your knees locked all day, the joints aren't going to last very long. So in the same instance, if you don't have a curve in your neck, it's going to put twice, if not more, the amount of stress and pressure and weight on the neck. So first thing we're looking for is a good curve in the neck. Another thing to keep in mind is the skin of my hand or skin of my palm acts like your spinal cord. And if you don't have that curve in your neck, which we'll show you a picture of someone in a second, it's going to actually stretch my skin when I take away the curve. It's going to do the same thing to your spinal cord. So when you stretch the spinal cord, it's the same as compressing it. Imagine a rubber tube you're stretching. The inside will get more narrow. Now they've connected this not only to neck pain, headaches, reduced range of motion, but they've also connected stretching of the spinal cord to Alzheimer's, dementia, Parkinson's, MS, a lot of neurologic disorders that happen later in life, but are very critical, and you can prevent this connection if you catch it early enough. So a couple other things I want you to notice. If you see the spacing between the bones, that's the disc spacing. We want to see clear, equal, thick disc spacing. That's really important because the nerves come out right in between the discs. So if you don't have enough disc spacing, you're also getting nerve compression. Now also notice how smooth these little cubes are. These little cubes are the vertebrae bodies, or the vertebral bodies. The smoother, the better. Now I'm going to show you another picture. Now you can kind of see visually they don't look the same. You don't have to be an x-ray specialist to see this. But the first thing you notice is we don't have that curve. We've lost that curve. So now we're adding a lot more stress and pressure on the neck because it's not dissipating the weight of the head, but we're also stretching out the spinal cord and stretching out some of the spinal nerves that come out of the neck in between these little holes here. Now another thing I want you to notice is see how up and down this person's neck is? See how much more forward this person's neck is? For every inch your head is forward, the weight of your head will double on the rest of your neck as well as the rest of your spine. So think of a bowling ball on top of a broomstick. And the broomstick is simulating the spine, the bowling ball is simulating your head. If you hold that broomstick straight up and down, it's difficult but doable. The minute you tip the broomstick even 1 inch forward, all of that extra stress you would feel in your forearms is the same amount of extra stress that's going to be felt in your neck and your lower back. So really important, really critical stuff. So moving forward, here's another example of a degenerative neck. So this neck, you can see, not only has it lost its curve, it's starting to curve the opposite direction. This is what we call a cervical kyphosis. A cervical lordosis means you have the proper curve going the proper direction. A cervical kyphosis means it's actually flexing the wrong way. This can lead to a number of different medical concerns. You can Google those yourself, but anything from reduced range of motion, increased discomfort, increased pain. It can even lead to paralysis if it gets strong enough. But I want you to notice a couple things. See the spacing on a healthy neck, and then see how we're losing spacing here and here. Another thing I want you to notice, see how smooth these little cubes are? Over here we're getting these like teeth-like, claw-like projections. These are what we call bone spurs, or technically speaking, osteophytes, which are the growth of additional bone because of that extra stress the neck is under and the extra weight and pressure. It literally has to grow extra bone, which is kind of like adding cement to a column, a bridge support column to make it stronger because it can't hold the weight of the bridge any longer. So that's kind of how the spine degenerates. The great thing about teeth, and we all brush and floss every day, is that if they did break down enough, we could replace them if we had to. Bad thing about a spine is if it breaks down too much, even surgically we can't replace it. We can just do our best job to keep it from getting worse. So that's why we try to catch things before they get too progressed and too severe, too degenerative. Again, think of a banana. So if you took a banana and tried to straighten a banana out, obviously it's going to burst out the sides and it's going to just destroy the banana. That same amount of force and stress is in this person's neck all day long. So this last person that I showed, this person came in, they had severe headaches, severe neck issues. They also had thyroid issues. Now, we haven't shown you the diagram yet, but the nerves that come out of your neck here, they literally control the thyroid, the heart, the lungs, the ears, the eyes, the nose. Everywhere through the neck, a different nerve has a different organ function or organ control job. So specifically, this person was on medication for all three things. Within a few months of helping them out, not only did we get them to feel better, but we got them off most of their medication, which was really awesome, because one of our missions here at UTC Chiropractic is to help you avoid drugs, avoid surgery, and if you're already on drugs, help you get off, or if you're already scheduled for surgery, hopefully delay that if possible. There's always a time and a place for that stuff, but again, on the natural side of things, we're trying to help prevent that. This gentleman came in, this guy's in his mid-40s. I know it looks like probably someone in their 70s or 80s, but this guy had respiratory issues, heart issues, thyroid issues, as well as neck pain and headaches. And again, within a few months, we were able to help this person, start reducing a lot of that stuff. So kind of cool. Moving forward, so this is the diagram I was talking about. This is the one we showed you earlier, where we were explaining how the brain controls the body. But you can see the nerves, if you can, from that far away. The nerves at the base of the neck, these nerves come out and control the thyroid. So if you're having trouble with weight gain, weight loss, low energy, fatigue, any of those things, that's going to have a lot to do with how well your thyroid is working and how well your brain is able to communicate, control, and assist the thyroid in its function. Same with the heart and the lungs. If the nerves coming out of the base of the neck going to the heart and lungs aren't functioning properly, it doesn't matter how well you exercise or how good you eat. I mean, that's all critical, but this is going to limit you. Your nervous system, which is your brain, your spinal cord, and your nerves, that's your computer system. If that's only working 80% of 100, and you're exercising and doing all the other healthy stuff at 100%, you're still only going to be 80% healthy, because it's all governed by what's controlling your body. So pretty important. So a couple key facts I wanted to go over here too. The Journal of Geriatrics, Spine Journal, and the Mayo Clinic said that loss of neck curvature causes patients to die sooner. Most of these people had no symptoms until severe changes had already developed. Another study out of the Journal of Bone and Joint Surgery in 1981, a deviation from normal spinal alignment increases mortality, resulting in 14 years off your life. So not only can an unhealthy spine affect how you feel and how your body is actually functioning internally, but it can even shorten how long you live. 14 years is like picking up smoking right now. So pretty significant. Another, if you look up Roger Sperry, medical doctor in the 80s, won a Nobel Prize for determining that 90% of the health of your brain is based on the health and movement of your spine. So it's a lot more important than just how it feels. That's why we have a lot of wellness patients that come in not just because they're in pain, but they're trying to maximize how healthy they are, how long they live. That's why I get adjusted every week. You guys can do whatever you want to do, whether it's one time or however long we see you. I just want you to fully understand. We want you guys to have too much information and never return than too little information and come in here all the time, because it's not going to make sense to either one of us. So moving forward, this is a healthy lower back from the side, where this, again, kind of like the neck, this person is still facing this direction. A couple things you'll see that are similar to the neck. If you notice this curve again, almost like a banana again, and then we got the disc spacing and we got the smooth bone. So very similar to the neck. The only thing from the side view that would look different would be your mid-back, kind of from your shoulders to roughly about down here just below the shoulder blades. That's the thoracic spine. That would be bending the opposite way. But we didn't take that picture of you. We didn't want to do too many x-rays of you. But in the future, if I believe that's necessary, we may take that additional image. But let's continue on. So you can see this is a picture of someone with not a very healthy lower spine. So we've got decreased disc spacing compared to what they should be. We have shifts in the alignment. We have bone spurring going on. A lot of trouble, a lot of degeneration. Again, a lot of this stuff, if it gets too strong, naturally or surgically, there's not much we can do. That's why it's so critical to keep your spine healthy instead of waiting for it to hurt. You know, it's like waiting for your car to break down and then saying, you know what, I probably should change the oil. You know, or waiting for your teeth to hurt. You know what, I should probably start brushing. They're starting to hurt. You already have something going on. There's already probably some damage there. So another little fun fact that I thought was important is that every 7 years, your body's going to fully be brand new. Every cell, every tissue in your body, except for 2 parts of your body, and that's your brain and your spinal cord. Your brain and your spinal cord don't regenerate, so you have to take really good care of the first brain and spinal cord you're given, because that's the last one you're going to be given. Even the bones of your spine, even though they do regenerate, they don't have the chance that you know the rest of your body does. So you don't want to let it get too beat up. The brain and spinal cord are also the first 2 organs that grow in the unborn baby, because they control and regulate the growth of all the other parts of the baby. So kind of an interesting point. So the nerves in the low back, because if we look at this person's spine, they've obviously got a lot of compression, obviously got a lot of nerves getting compressed. These nerves down here go into things like your digestive system, your bowel, your bladder, your reproductive system, the kidneys. So a lot of areas that people don't think of when they have low back issues is where the nerves come out and where they go. So that's kind of interesting. This is a picture, if you don't already know by looking at it, this is a picture of scoliosis. So this person's spine, again, if you remember from the front or back, this should be straight. This big bend here is kind of like a column supporting a bridge that's starting to buckle. Obviously Caltrans would have to get out there and add more cement, add some supports. This person's spine literally has bent out of position. Now this girl came in, she was only 15 years old. She was a volleyball player, had a lot of low back pain. Didn't explain to me though until for a few weeks into treatment and into care that she was still wetting the bed. And at 15 years old, that's unusual. But if you think about it, the nerves that come out of the lower back, they do control the bladder. So not only were we able to help this girl with her low back issues, but within a few weeks, she had stopped wetting the bed. So pretty cool stuff. The nerves, like I said, it's all about how your brain controls your body. So it's more, again, than just discomfort. The reason I go through this, again, I just want you guys to be fully informed and know everything we're about, everything we want to try to help you with, depending on your own personal goals. If you just want to feel better, you're not concerned with the health of your body internally as much as you are about just some relief, we're cool with that too. We just want to make sure we explain it all. Now, a lot of times people will ask me, what was it that caused their spine to get the way it is today? It's not necessarily one thing, like one car accident or one fall out of a tree or one issue you had. It's a culmination of your entire life. So when you were learning to crawl and walk, you were falling more at that period of time than you will the rest of your entire life. If you played any contact sports, every car accident you're in, every slip and fall that ever occurred to you, that all accumulates over time, kind of like waves washing away a cliff. It's progressive, but can be very destructive. Now, you got to also think too, your body is constantly under stress. Most of us have desk jobs, we're hunching over, we have horrible posture. The conveniences of technology have forced us to get on our phones and look over. So we're putting our bodies in horrible positions hours and hours and hours a day. Multiply that by years, then by decades. It's not a coincidence that your spine looks the way it was. If most of the people that come in here are already in their 20s or 30s by the time they first see a chiropractor, imagine if that was the first time you'd gone to a dentist your entire life was in your 20s or 30s. More than likely they're going to find something going on. So it's not like we're just trying to make stuff up. It's just you've spent most of your life hoping everything was okay because you can't see your spine and you assume if it feels okay, it's healthy. Now this is really important because we do see a lot of kids in the practice, and I always get a new patient here and there that says, well, what kind of problem or back or neck problem could an infant or a toddler or a young child have? It has a lot to do a lot of times with the birthing process. Now, in this country, unfortunately, they're still doing a lot of forceps and vacuum extraction, which if you can see this, it's a little blurry. They're pulling children out with 140 to 170 pounds of force. Even if they're not using forceps and vacuum extraction, they're pulling out manually, they're pulling on the child's head with anywhere from 80 to 90 pounds of pressure. So imagine holding a baby by its ankles and wrapping a 90-pound weight around its neck and swinging it back and forth. It's a horrible vision, so don't think too long. But you can understand why that would put a lot of stress, especially on the neck. So a medical doctor from Harvard started doing autopsies on these kids and found a direct connection between blood blisters on the spinal cord and sudden infant death syndrome that was caused by the trauma of regular delivery. So a lot of people ask, when did this problem that I currently have start? In many, many cases, according to the medical studies, 80% of children are already born subluxated. This is an x-ray of an 8-year-old who's already lost the curvature of his neck. He's already on Ritalin for ADD, and he already has a lot of headaches, which children don't typically have at that age. But again, with technology, some of the birth trauma, it's not surprising that we're finding more of this stuff going on. So real quick, we're going to go over the treatment options, and then I'll wrap this up. So when you're going down the medical road, you've got the painkillers, you've got the muscle relaxers, you've got the anti-inflammatories, you've also got physical therapy, then you've also got spinal surgery. When it comes to the painkillers, the muscle relaxers, the anti-inflammatories, unfortunately, the side effects are really dangerous, really significant. If you know what an NSAID is, which is a non-steroidal anti-inflammatory drug, 16 to 17,000 people a year are taking that from regular dosage, which works out to, I believe, about 1 in 1,000 people that take it for 2 months or more at regular dosage are actually dying from internal either ulcerations or internal bleeding. So it's a risky, scary kind of thing. Even an anti-inflammatory isn't really reducing the inflammation. Your blood inflammation would be the same if I drew your blood before and after I gave you the anti-inflammatory. It just shuts the receptor signal to the brain off. So you still have the same amount of inflammation. My problem with the painkillers or any type of muscle relaxer or anti-inflammatory is it's artificially telling you you're feeling better. And then you go out and you do more physical activity, you make that condition worse, and then you're going to have a lot longer road to recovery. I mean, the human body is very, very smart, very advanced. It will put something in spasm or make it inflamed or make it painful so that you don't injure it worse. But then what we want to do so quickly is swallow a pill that makes it better so we can go do what we want to do. But I digress. Either way, not my favorite road. I'm not saying there isn't a time or a place. I don't judge you if you do it, but that is an option for you. Physical therapy, spinal surgery. This is a couple pictures of spinal surgery. They basically drill these titanium rods into your spine. Not something I want to sign up for. This is another version of a spinal fusion. It looks like a Home Depot bracket. They drill into your spine. Not something I would want to jump either myself or someone I cared about into. So if we can help prevent this and avoid this, I'm sure you'd prefer that too. There is a time and a place for this, and this does do wonderful things for people that are suffering. But again, our mission is to try to help you prevent that and avoid it. There is a pretty significantly high failure rate with surgery, upwards of 80 to 84% failure rate after 12 months of the surgery. 50% of the people that have it don't even go back to work. So pretty significant here, just things you want to be aware of. 42.7% of the time you see your medical doctor first, and I'm not trying to say anything negative about that, but just statistically, you're going to end up in surgery, whereas 1.5% of the time you go to a chiropractor first, you're going to end up in surgery. So, they're not trying to put you into surgery usually by the time you see them. It's pretty advanced, but just statistically, we want to help avoid that. Now, a lot of people ask me about stretching, about strengthening and all that. Really important for you to do, especially for the health of any, not just your spine, but your entire body. I was a strength coach for 12 years, a personal trainer for 10. Everybody, if I could get every patient to do yoga, do Pilates, go to the gym, do what they could do to stay strong, stay physically fit, not just doing aerobic activity, but strengthening and stretching, I would. But unfortunately, if you've got a crooked spine and you lay muscle on top of a crooked spine, you're just going to have a strong crooked spine. You're going to reinforce that. You may even make it worse. Same with flexibility. If you've got a crooked spine and you go to yoga every day, you're going to have a flexible crooked spine. And I can show you x-ray after x-ray of professional athlete, personal trainer, yoga instructor that you would assume would have a really healthy aligned spine, that in some cases it's more severe than an average person because they're doing a lot more with their body. So just kind of food for thought. When it comes to chiropractic care, there's really two directions we can go. Relief care is what most people assume we do, which is you just get adjusted until you feel better, which is fantastic. It's better than taking drugs. It's very effective at doing that. But if all we do is reduce your symptoms and we never correct the underlying condition, you just need to be aware that those symptoms are going to return sooner or later, whether it's a few weeks, a few months, excuse me, whether it's a couple years. If you're lucky, sooner or later they're coming back. Picture a cavity in a tooth that doesn't hurt necessarily, or maybe it does, and we inject it with Novocaine, and that buys you a few weeks of pain relief. That cavity is still going to continue to get bigger and more severe. So it's just important, that you understand what you're getting into. I don't mind which direction you go, and I don't judge either direction. Excuse me, but you got to understand what you're expecting out of it. Because I'll get some patients that will see, even from the beginning, once every couple weeks, once every month or two, and it's the same as going to the gym once every couple weeks, once every month or two. I will fully support you, but I don't want you to expect massive amount of change if that's as frequent as you're seeing you, because you wouldn't expect it from the gym. You wouldn't expect it from, you know, even a diet. So just keep that in perspective. Now, corrective care is option 2. That's what we specialize in. And the reason we specialize in this is I don't want to just get you to feel better temporarily, and then each year you're a patient, you're going to get more, you know, your condition's going to get more severe. I want to not only get rid of your issue, correct the health of your spine, your nervous system, and the function of your body, but I want to keep you healthy. So once we correct your spine and get it as healthy as we can, not only getting you out of pain or discomfort, but also improving your alignment and increasing the health of your nerve flow. But once we're able to do that and everything as healthy as we can get it, guess what our job is next, at least theoretically, is to keep it there. You know, it doesn't do you any good to get into really good shape and then just to let it all go back. You can do that, you can do whatever you want, but just understand what you're getting into. So think of corrective care a lot like braces on teeth, okay? Most people have to wear braces anywhere from at least a year, sometimes upwards of 3 or 4 years, to take tiny little teeth and move them maybe a millimeter or two. When it comes to spinal correction, it's very similar. Another analogy I use is trying to lose 50 to 100 pounds. You got to work out 5 days a week, if not more, over the course of 6 to 12 months, just to see a reduction in maybe 4 or 5 pounds a month. So you got to be realistic with the amount of time it takes. When it comes to spinal correction, it's going to be based on how old the patient is, how much degeneration they have, because there's 4 phases of degeneration, how severe your condition is, and it's going to take at least 60 visits, according to the studies. I didn't do the studies, I just read them. At least 60 visits within a 6 to 12 month period to make any sort of correction of your spine, whether it's on the x-rays, the nerve scans, anything like that, that's going to have any permanent effect. We can definitely do less, just understand we're not going to be able to make corrective changes if we do less than this. We start 3 days a week for the first few months on corrective care. We reduce to twice a week for the next few months, and then we typically reevaluate at 6 months, and normally we'll go into once a week or every other week at that point. That's pretty standard, depending on how much correction we're trying to make. We will do re-exams every month to make sure that you're progressing the way you're supposed to, whether or not we need to change anything. And at the end of either 6 months or 12 months, we will do a complete reevaluation, including re-x-rays, to see what kind of progress we've made, where we are at that point, and whether or not we need more correction or if we're ready to move into maintenance, depending on what your goals are again at that point. So again, when we're talking about phases of degeneration, if you've got a healthy, normal spine and you want to keep it healthy, you still got to get adjusted here and there. We typically see people on maintenance about once or twice a month, because every week to 2 weeks, your spine is going to shift out of position no matter who you are, no matter what you do. That's the average. Every week to 2 weeks, the spine's going to subluxate. So best amount of maintenance would be to adjust you every week to 2 weeks, at a minimum every month. Again, that's ideal maintenance. You guys can do whatever you want. If you're in phase 1, you've lost 25% of the health of your spine, health and alignment of your spine. So this has taken about 10 years typically for this to develop. So if you come in and you're in a phase 1, it took 10 years to get there. If you're in a phase 2, you've lost 50% of the health and alignment of your spine. It takes typically about 20 years to get to this position. Phase 3, you've lost about 75% of the health of your spine. It takes about 30 years, give or take, to get here. If you're in phase 4, you're in a lot of trouble. There's little we can do at that point. We definitely can't make much correction there because the spine has already fused into itself. So even at phase 3, where it's getting difficult, if you guys had to guess which phase comes up the most, I'll give you a second, but it's going to be phase 2. And this is because you don't feel symptoms until 40 to 70% of any cell tissue or organ in your body has been diseased or damaged. So when it comes to your spine, which is a cell tissue or organ, it takes 40 to 70% before you feel anything. That's usually when you guys come into the office. And it's not always the 40%ers, because they usually try a painkiller first or massage or something more general. By that time, 50% is usually how damaged the spine already is. So we're already behind the bubble in trying to get you guys well. Now, a couple before and afters, and then we'll wrap this up. I've got, I think, 2-3 slides. So this was Peter when he first came in. Peter came in, had a lot of neck issues, a lot of headaches. He was having respiratory issues. Took us 6 months, not my best example, but you can see the difference between not just his posture, but now we're starting to get more of a curvature in his spine, more of that banana-shaped curve. So not only does he feel better, but the nerves coming out of his neck are working a lot better. Now this is Michael. Michael came in, he'd been to many chiropractors before. He was a friend of my dad's, he'd heard good things. He said, you know what, I want to come see you, Dr. Josh, I want to see you 10 times, and I want to spread it out over the year. And he said that because his insurance gave him 10 visits spread out, and he wanted to spread them out. Now, you know, I care about everybody that comes into the office, but your insurance is only concerned with the minimum amount they need to do according to a national average. My computer talks to their computer. I don't physically get on the phone and speak to somebody from the insurance company and say, hey, you know, Michael's in bad shape, can we give him 30 instead of 10? It doesn't work like that. There's an average, there's a set parameter we have to stay within, and their job is just to do the little, to provide the minimum amount to get you feeling better. And if 10 visits doesn't do it, or some insurance, if they only give us 5 visits, even though it may tell you have 30 visits, they'll only let us do 5 without getting like a medical, you know, referral for it. Their job is to do the least they have to. And unfortunately, Mike comes in looking like this. He's got a ton of low back pain. He hasn't had a bowel movement in 2 weeks. And if I were to adjust him 10 times in 12 months, that'd be like Mike trying to lose 50 pounds, if we're trying to correct this, in 12 months, working out 10 times in 12 months. It'd be very difficult to do that. You know, I could make things feel a little bit better, and you're more than welcome to go that route. But like I said, I just want you to understand what the outcomes will be. It took us, again, I believe between 6 and 9 months to get Michael from here to here. Again, going at 3 days a week, down to 2, down to 1. But, you know, like I said, Michael hadn't had a bowel movement in 2 weeks. The #1 cancer in the country is colon cancer, so it was critical. Literally within, I think, the first month, he was going regularly, as in daily. So I know that's a little TMI, but still, it was really important for Mike. Last one is Sandeep. Sandeep came in. You can see this area here has been out of position. It should be straight. This was his before. This is his after. Came in. He had a lot of chronic kidney issues, chronic kidney stones, chronic kidney inflammation. So he was on medication for this, as well as he had a lot of low back pain, same area, because the nerves go to the same place. And within a few months, this I believe was 6 months or 12 months, I can't recall, but you can see the difference between each one. So you got to, again, going back to the frame of the car, the better the alignment, the longer it lasts. So you got to think how, you know, do you want to just feel good for a little while, or do you want to get as healthy as you can for as long as you can? Either way, we'll support you, we'll help you either way. Hopefully, I know I spoke really fast. Hopefully this will give you at least some you know, like a foundation as to what we're going to review with you when you come in. I know it's a little lengthy, but we want you to be very informed. So thank you guys for taking the time to review this. Last thing I'll leave you with, if you are married or if you do have a significant other that you do live with, it's really important that they're here with you so that we can review all of your test results with you, and hopefully you can have them watch this video with you, because they're going to have their own questions and they're going to need to support you with whichever direction you go. So it's important that they fully understand what's going on. Have them watch this, have them come with, you know, we'd be more than happy to have them, you know, be there with you. And other than that, thank you for watching this video. We're looking forward to seeing you soon, and hopefully we're going to be able to help you guys out. Thank you very much.